the Age Management Medicine Conference here in Tucson, Arizona. And we're interviewing right now with Dr. Song, who was actually one of the lecturers at the aesthetics track. Dr. Song, tell us why you decided you wanted to participate and obviously share your knowledge with us in that track.
Well, first of all, I was really honored to be asked to speak at this conference. And it's an amazing conference because the practitioners that are coming here are really doctors and practitioners who are looking to practice outside of the box, whether it's hormone treatments or aesthetic treatments. These are people who are really interested in the latest and newest treatments that are scientifically based. And I know that that's what a lot of my colleagues come here for. And I know I learned a lot from listening to the speakers. And I just wanted to have that opportunity to share my knowledge, which I spoke on the topic of platelet-rich plasma, which is something that has there's a lot of interest in at this time.
Right, it seems like it's the hot topic right now. But all plasma, I presume, or PRP is not created equal?
Yeah, so PRP, for those who don't know, stands for platelet-rich plasma. And it's interesting how, because it's become so popular, especially with the vampire branding, patients are looking for that, and many doctors don't even know what the PRP stands for, not to mention what it actually does. And this is a field of regenerative medicine where we can take the products that your own body makes and use that to regenerate new skin and create almost a reversing of the aging process in some cases.
And obviously, most of us, and myself included, are very interested in regenerative medicine. And I noticed then that you combine the PRP with other types of treatment programs, such as the RF microneedling that you were lecturing on at this.
Yes, so there are a lot of different treatments that a doctor can do for their patients. And sometimes it's overwhelming to try to figure out which is going to work the best. And a lot of times the treatments are just driven by the patients after they've seen an advertisement for some laser or a product. And I just wanted to help the doctors be able to direct the choices to choose the treatments for their patients that are going to really help them. And I've discovered that by combining the platelet-rich plasma with some of the technologies out there, like the microneedling and the microneedling with radiofrequency, and if you combine that with your own regenerative products from your own body, you're going to get results that are much, much more significant than using one treatment alone. And this day and age, quite frankly, there are a lot of aesthetic practitioners out there, and people are competing with each other. And unfortunately, a lot of that competition is just on price. But I wanted to be able to share my experience and show these doctors how they don't have to be there competing on price with the daily deals and things like that. If they can deliver a treatment with results that their competitors aren't able to deliver, they are not going to have any competition. And that's the beauty of this. If you can, keep up with some of this regenerative medicine that is going on, and it, admittedly, it is a very fast-moving field. So you do need to kind of keep up with it, and that's why a conference like this is so good. I came to this conference 6 months ago, and even in that short time, so much has changed.
Right, and obviously you made a great transition too, because originally you were internal medicine, and now you have a fantastic aesthetics practice.
I did. I started off in internal medicine. I practiced medicine for 15 years, and I don't regret it. But about 10 years ago, I decided that it was time for a change to do something different. And I got the best of both worlds because I got to practice medicine and save lives and things like that. And now, I might not be saving lives, but I feel that I'm certainly changing lives. And if I can take a person who is feeling old and thinking their life is over and doing some simple treatments, make them feel like they're young again, that is just an amazing transformation that not only changes your appearance, but can change your whole attitude.
Right. And I think, too, that's always the challenge for the doctor in the initial phase is this is where I am today and this is where I want to be tomorrow. How do I make that journey? Because we all know if you don't make the journey correctly, there's pitfalls on the way that can swallow you up.
It's scary because if you're used to practicing in a certain way and thinking of making a change, and especially if you're going from a regular medical practice to an aesthetic practice, it's a very different way of thinking. And it is scary because you're used to doing an insurance-based practice and now you're actually having to ask patients to pay you for your services. And that's something that most doctors are not really comfortable with. And what I can say to that is, if you're giving them the treatments that are going to deliver the results that they're looking for, they're happy to pay you for it. And that was something that was a little surprising to me, because when I was practicing medicine, people were reluctant to even pay you the copay because they felt that that was something they were entitled to. But this is something they want. Right. And we are able to deliver treatments that are really science-based. We know that the regenerative process is occurring in our body, and now we know how to harness it. And so that's what makes this so exciting. And I know you had a journey when you first started off then, because obviously expensive equipment is expensive equipment. And I'm sure if you could do it all again, you might make a few changes. Yeah, and that's why I decided to go, in addition to doing this practice, I wanted to do the teaching as well. And I'm doing classes and workshops to teach other physicians how to make this transition, because unfortunately, if there's a mistake to be made, I've made them. Right. And I'm still here, and I'm blessed to have a practice that's doing very well and thriving and exciting. So I want to be able to pass that knowledge on to others who are entering this field, so that we can make it a little easier for them, and be able to just share that knowledge with my colleagues. And I think, obviously here, there is a sense of relaxation then, and sharing information and camaraderie then, because everybody's interested in this new field and in moving forward and in providing results, and providing results how the patient wants, because that's the worst of us patients. We want to look way younger, but we really don't want an arduous task to get to that point. Yeah, so the camaraderie is important, because in this field it's actually kind of lonely. When I was practicing medicine, I was always interacting with my colleagues, whether it's consulting a specialist or just interacting with other doctors in the doctor's lounge. With this practice, I don't admit patients to the hospital, so I haven't had an admission in 10 years, so I hadn't had the occasion to go hang out in the doctor's lounge. I'm in my office, and so it's very refreshing to be able to come here, interact with like-minded people, and be able to share the ideas, share the experiences, and I think that's so valuable. I agree with you, and I appreciate you. Like I say, hopefully we'll see you in Orlando. And hopefully we'll have a whole bunch of new people that are going to be there, putting you on the right track. I'm looking forward to it, and all I can say is if you haven't been to this conference, I think it's well worth coming.